people safe, in providing essential healthcare to those not just with COVID, but more broadly with a health system that is under pressure. Whether it's here in New South Wales or around the country, we rely on our frontline health professionals to continue to look after us. They have done an amazing job over the past 2 years. And as we move through what will certainly be a challenging 3 to 4 weeks for our state, we will rely on them more than ever to continue the great care, the great compassion in which they look after every single person right across the state. So can I thank every one of them on behalf of the people of New South Wales. Our key message today, though, is still in relation to vaccination. We have one of the highest vaccination rates here in New South Wales, and that is key to keeping you, your family and your friends safe. We've seen here in New South Wales a 93.7 double vaccination rate, and we have over 95% of people with a first dose vaccination. I say to anybody out across New South Wales today who've received that first dose vaccination and is eligible for your second dose vaccination, please go out and make the effort to get it done. It's so pleasing. We never believed we'd be in a position with over a 95% vaccination rate, but we really want to ensure that that second dose vaccination rate gets above 95%. So if you haven't received that vaccination, that second dose vaccination, please go and do so. And if you haven't received that first dose vaccination, please go and get vaccinated. The numbers don't lie. If we look at ICU numbers, if we look at hospitalisation numbers, there is no doubt, it is very clear that vaccination is key to keeping you safe. Our booster shot campaign continues right across the state. We have 40 centres open. In the last 24 hours, over 15,000 third dose booster shots were administered in our facilities across New South Wales, over 320,000 now across our state. And as we head into mid to late January, we'll be seeing just in our centres alone around 300,000 booster shots per week administered. As I've said in the past, you can have that booster shot administered at your pharmacy, your GP, or at one of our centres simply because you've had your vaccination shots in either in a hub or your GP, your pharmacist. You don't have to go back to the same place. Please make those appointments. And as of tomorrow, and Dr. McAnulty will speak to this as well, as of tomorrow, we will be rolling out vaccinations for children aged between 5 and 11. That commences tomorrow. Many people have made those bookings, and that is key as well as we move through this next phase. So we've also announced that in addition to the 50 million rapid antigen tests that we have procured, that we will be procuring an additional 50 million as well to take those rapid antigen tests procured by the New South Wales government to 100 million. And we will be rolling those out. Across the state, particularly in those areas where there are vulnerable people. We're already at the moment, as of today, have been reaching out to remote Aboriginal communities with those rapid antigen tests. These tests will be crucial to ensure we get kids back to school day one, term one. We are finalising our back to school plans at the moment. This will be a core tenet of those plans of getting kids back in the classrooms. We are completely committed to doing that. That is exactly the focus of the New South Wales government. It is crucial that kids are back into school on day one, and that is our focus, and we'll be raising those plans with the federal government at National Cabinet later this week, and we will, once we've finalised those plans, we'll release them to the public so that parents right across the state can have confidence that we'll be able to achieve ensuring that kids are back on day one. There will be bumps along the way. There will be challenges as we move through this return to school program, but ultimately we can't let perfection be the enemy of the good. We need our kids in class. It is very, very clear that that is the best approach to take, and we are committed to doing that. And our booster campaign and through our rapid antigen test that we have procured, that will play a key role in ensuring that we can achieve that outcome. We've had the first set of rapid antigen tests arrive yesterday, and we'll see over the coming week and the weeks ahead those additional tests coming through. This will be very important as part of the new norm as we move through the next phase of the pandemic, that rapid antigen tests need to be provided and available to people right across the state. from our government's perspective, particularly for those in vulnerable areas, in aged care and disability services, and I know a lot of those areas are in the domain of the federal government. From a state government level, we will do everything we can to support that rollout and complement it. So Minister Ayres will speak further to that. The other change we made today from New South Wales Health is an exemption for close contacts in essential food distribution networks. We had a similar approach during the lockdown period in relation to essential workers, and what that will mean if you are deemed by your employer in an essential food distribution network or manufacturing, that through the provision of a rapid antigen test on advice of your employer, you'll be able to return to work if you are asymptomatic. So that change comes in effective immediately today. Those orders were signed off this morning, and we believe that that will ease the pressure on supply and distribution networks, particularly for those essential areas across our state as we move through the next few weeks. Finally, in relation to those people who are at home who have had a rapid antigen test that is positive from mid this week, the advice I've received from Service New South Wales and from New South Wales Health is that you will be able to register that positive rapid antigen test through your Service New South Wales app, and that will ensure through the advice of New South Wales Health that we're able to connect people who need it with care. So it's not simply for the purpose of registering case numbers, it's for the purpose of connecting those people with underlying conditions with care. As the Prime Minister has also said, if you do have underlying conditions, then please contact your GP if you have any concerns, but we believe this program will assist. We'll have further to say about that over the course of the week, but obviously in circumstances where you've received a rapid antigen test and a PCR test that is positive, there will be no need for you to register through Service New South Wales because your details will already be connected to New South Wales Health through that PCR test process. So before I pass to Dr. McAnulty to give a public health update, and then to Dr. Nguyen to talk about the work that is occurring right across the state in our hospitals and the fantastic work that our nurses and doctors are doing day in, day out. There is no doubt for our state that this is a difficult time, just like across the country and just like across the world. But we have, as a state, as a people, have stood strong, incredibly strong, over the last 2 years with all the challenges that have come our way, and we've got through them like we will get through the next 3 to 4 weeks and beyond. If we can continue, and speaking to the nurses today about their experience with patients coming in what has been a difficult environment, the kindness and respect that has been shown from people to our health staff, but if we can continue to show that kindness and respect to everybody across the state to maintain that patience, the people of New South Wales will come through this difficult time as strongly as we have over the last 2 years. I'll now pass to Dr. McAnulty for a public health update. Dr. Nguyen will then speak to some of the challenges and experiences in hospitals, Nepean here, but across the board more broadly. And then Minister Ayres will give some further information in relation to the acquisition of those rapid antigen tests and changes to close contacts in relation to food distribution networks.